good to go?
Okay, hello everybody. I'm Ajoke Adebisi, and I'm so happy to welcome you all to the Engage Africa Foundation Festival 2023. We're excited to host this comprehensive mental health in Africa session, and we look forward to having a very great discussion, and we hope this session will be interactive with our panelists. We'll start by introducing ourselves. Like I said, I'm Ajoke, and I'm a public health practitioner, an adolescent and child health specialist, and a volunteer and team member with the Engage Africa Foundation. I look forward to an Africa where everyone, irrespective of their socioeconomic backgrounds and status, can access quality healthcare. And with me is...
And my name is Joyeuse Senga. I'm a community-based researcher. I'm currently based in Ottawa, Canada, and I'm also a volunteer with the Engage Africa Foundation. And I'm excited for this session, especially to really understand deeper how we can continue to advocate for mental health care in Africa. So Ajoke and I will be co-moderating this session today, and we're excited to have Rachel Uwase, our panelist. So I'll go ahead and introduce Rachel as well. So Rachel Uwase has been working to support victims of sexual violence at the international level since 2015. She works as the Director of Operations for Mutera Global Healing and holds a master's in nonprofit management. Rachel focuses on building the organization's development and leadership while also creating a comprehensive and holistic approach to preventing and responding to sexual violence. Rachel is trained in facilitating workshops on trauma healing, gender-based violence, delivering information on a way that holds space for survivors, and also local service providers to share their stories and really embody new possibilities of healing. So prior to working with Mutera, Rachel was also in the Philippines working in advocacy outreach with a nonprofit whose mission was to offer girl survivors of commercial sexual exploitation a path to restoration. So we're really excited to have you with us, Rachel, and welcome.
Thank you so much. It's an honor to be here with you guys. Thanks for having me.
Thank you. I'll let Ajoke go ahead and introduce our session.
Okay, we just have a brief overview of what the session will cover. As you may know, mental health care is severely underfunded in African countries, and data recorded in most health management systems does not include mental health. The lack of sufficient funding and data means that there is a gap in mental health care, and policymakers need to prioritize mental health. This session highlights the need to prioritize mental health care in Africa and also highlights community-led initiatives that have been impactful in raising awareness about mental health. We'll discuss what necessary steps need to be taken at the local, national, and international levels to ensure the issues surrounding mental health care in Africa are addressed to improve the quality of life of Africans. Now, I'll just start. Ms. Rachel, what are the key issues people with mental illness or disability face in Africa?
Some key issues. I think I will speak from the perspective of our work, at least with sexual abuse survivors.
Okay.
Yeah, some key takeaways are just lessons that we need to understand. I think when it comes to the mental health area with survivors, at least of trauma, it's ending. I would say one of the biggest ones we still struggle with is just ending the victim blaming, right? Because healing really begins with belief. Believing that they went through what they went through, showing them support, saying it wasn't their fault, and shifting the blame from the victim and rather holding the perpetrator or the abuser accountable. I think that's something we're not doing well, and we need to start doing more often. And I think that would really, really help and support not only victims, but even others to really see that they can also come forward with their issue or their abuse. Yeah.
Okay. Okay. So, like, I don't know, how does your organization or the work you do, how do you address victim blaming? How how do you address stigma and victim blaming?
Yeah, so one of the key areas that we're trying to work on right now, especially with our advocacy program, is trying to bridge the gap between with victim support. So being able to have immediate support given to a victim, someone who is trauma informed, someone who will know exactly what that victim has experienced and know how to show up for them and provide timely assistance. So as Mutera Global Healing, our three critical pillars, as we always say, are prevention, healing, and justice. And with the prevention piece, of course, it's the advocacy piece, the education piece of what is mental health, what is trauma. And then the healing piece is us. Actually, we work right now with social work students, graduates. We've actually been trying to we've got a group of graduates who are social work students and also who are law majors, and who are passionate about giving back to, their community. We're working in Uganda right now. And so what we wanted to do with them was inform them, one, empower them, give them the skills of being trauma informed, and then have them be able to be those first responders, having them be there ready to receive any news of a reporting of abuse going on, or someone dealing with mental health issue, with suicide ideation, whatever, and them knowing how to report in a timely manner. Because we always say that within trauma, especially sexual abuse trauma, with that first 24 hours is extremely important for the trajectory of their healing for the rest of their life. That first 24 hours, who they run into, is extremely important. So we want to have people who are there, who are bridging the gap, who are there to show support, and who know the things to say. And one of the things to not say is, maybe it was your fault, or why were you where you were? What were you doing? Yeah, what were you doing there? Or why were you with that person? There's never really a safe place to be. You can try, there are ways to keep yourself protected, but we know that even if you're in a safe place, if an abuser wants to abuse you, they will find a way. So we want to be able to have people who know the right language to use and how to support people who've experienced that kind of abuse and trauma.
Thank you.
Yeah, thank you for sharing that, especially the work that you're doing, really, that is very community-based and really engaging with people on the ground. But my next question kind of ties into that as well. We know that mental health is a big issue, especially in Africa. We see that 85% of people with depressive disorders are in low-income countries and are not receiving treatment. Why do you think that mental health care is under prioritized in many African countries? And as you do this work in the community, what are some of the things you do to really engage people and have the conversations about mental health?
I think, unfortunately, it's just not a priority, I think, in the medical space. We talk about how, at least in Uganda, if you have to almost be on the brink of death, or like you've broken an arm or something, to get care, the patient to doctor ratio is extremely wide. And so coming in with an issue of mental health just doesn't seem to be a priority, I think. So something we're trying to do is find those medical care survivors, those counselors, nurses, social workers who have experience in PTSD, who have experience in mental disorders, that are ready and willing to take on these kinds of cases. They have witnessed, they have experience in this work. And so I think that's where it lags, because I just don't think it's a priority for most countries, especially just when you look at the doctor to patient ratio.
Yeah.
Okay. I'll just follow up on that. But what are some barriers to mental health care services? Like, from your experience, from the work you do, what are some barriers in Africa?
I think being trauma informed. To be honest, I think being informed of all the different ways in which someone can be suffering from a mental health disorder of some sort. It shows up so differently in everyone, in from a child to an adult to an adolescent to a teenager. It shows up so differently in all of us. And I think, I'll go back to, I just don't think there's enough people who are trauma informed in this work.
Yeah. Yeah, thank you for
That's a
sharing that.
huge barrier, when you notice. And I think the education piece on it is really missing. And so I think that then you don't receive the services and care that you need,
Okay. How have you, the work you do and the organization, how have you tried to address this education gap? How have you, in the African region, how have you addressed the education gap?
Yeah, it's our trauma healing workshops for us with Matera Healing. We have a handbook that is specifically catered to trauma healing and to giving a really deep dive on what is trauma, how does it show up in our body, what is emotional regulation, showing how we like to use the tagline, trauma not transformed is trauma transferred. So how, getting a picture of the cycles of harm in communities and individuals and families. So we do workshops that last, from 3 to 5 days, as long as really people need it. And we do heavy work on people getting this information, but then also being able to take it and teach others in their own community. That's something that's helped Matera grow, and just being able to raise advocates, raise people who are speaking the same language, are passionate about helping one another and showing up for people in these ways. It has created a ripple effect that we are absolutely overjoyed about and are wanting to replicate as much as we can all over East Africa, but we also have partners in West Africa as well. So that piece of being trauma informed, we make sure that our workshops do that.
Yeah. That's amazing, because you're really doing a lot of great work to do that education and raising awareness.
Holding that space it's not easy, because you realize that these service providers or whoever wants to do this work has their own trauma, right? Has their own thing that they're possibly coming in the room with. And so it's holding space for them, but then also teaching them and allowing them to also find a way that they can hold space for others. So it is heavy emotional work, but we touch on self-care. We touch on having your own resources to tap into so that you don't burn out, having ways to have boundaries for yourself, when you're doing this work, because it's not easy. And we understand that. So we know that we have to care for those who are caring for others as well, and give them the tools that they need.
Yeah. I love that you especially provide things that are practical. And one of the questions we had was that your organization is really doing amazing work, and there are many locally based organizations working in the community. How can decision makers, even governments, take the tools that you're providing really to scale up those services, or even emulate the things that you're doing to really scale up the services that address mental health issues and provide extensive mental health services?
Yeah, I think amplifying the voices of survivors of mental health, having them be in the rooms to make key decisions, them sharing their experiences. Allies are essential in this kind of fight. They help remove the stigma. If we're going to talk about mental health, we need to bring in people who are survivors of this, who have figured out what's worked for them, who've received help. I think that is really good to do on a community level, even in policy making. We are trying to create survivor-led networks when it comes to this work that we're doing. And then we, as Matera, we're also part of a larger coalition called Brave Movement, which basically is also about, eradicating child sexual violence. But also these pieces of being trauma informed, of mental health, reducing violence in communities, putting perpetrators away, abusers away, etc. So this coalition is working with, there's a Brave Movement Global and there's a Brave Movement Africa, which that one is bringing together all the different organizations within Africa that do similar work, right? So we're not doing it in silos, because if we come together, there's power in numbers, right? And so we can take what we're doing, our experiences, our work, and take it to like the AU and say, hey, here are some key things we want to address this coming year, and we need your help to be able to do so. And here are our demands, and here's how many people are already doing this work. So I think, yes, we should be able to prioritize funding to go to these smaller grassroots organizations that are doing the heavy work. So I love coalitions that bring organizations together that are already doing similar work, so we're not all scattered, trying to fight and do this on our own.
Yeah, I'm happy with the way like you're working with grassroots organizations, bringing other organizations together, working with the AU, working with government. But how can African governments close the gap in equity when it comes to achieving mental health services, good mental health care and services in Africa? How can they close the gap of equity?
Yeah, it's having access, right? It's being able to create more healthcare centers that have people who are educated in this work, who are trauma informed, to be there and ready to receive patients, right? So something we were doing early on in this work was working with local organizations to build more healing centers and more safe spaces in lower income communities or rural communities, or in islands that just don't get anyone there. Just building more people to come together in these healing centers and being available, I think, and not stigmatizing it, because it's needed. We need safe spaces. You cannot begin this work without creating safe spaces for people who are not doing well mentally or who are not safe in the environment that they're in. So I think that access to it is important, and getting funding to be able to do that is necessary.
Yeah, I think when it comes to access to, there is also the issue of including mental health care in primary care. And I think you already mentioned just the lack of awareness of mental health in the clinical setting as well. So have you seen any progress, or what do you think can really be done for mental health to be included in primary care access, so it's more accessible to all the communities?
Yeah, that's really good. Yeah, I think I always go back to the piece of are they prioritizing these kinds of issues in community members who come in and say, they're having nightmares, they have experiencing PTSD, they're experiencing, triggers that are lasting a long time, and all these things. Do they care that people are going through this? Because you tend to find out that that's, again, they think that's a family issue or an individual issue that should just be taken care of alone. But you find out that when these things are not taken care of early on, they have long lasting effects on people. One thing can develop into another. So I think it's being able to take cases seriously when they come in and they're expressing smaller sort of symptoms of mental health to a primary care survivor, that they ask follow-up questions and say, what's going on holistically, what's going on at home, what's going on in, at school, etc. Giving it that time at the primary care level. I think I'd love to see that.
Okay, and what are some consequences of not responding to these issues, like the lack of treatment of mental health issues? What are some consequences?
Well, in our work, it's with sexual assault survivors, there's a higher you're now risking for someone to be re-victimized, right? They're higher if they don't seek the help that they want, they're more likely to be re-victimized. So there's so many risks to not getting the support that you need, the immediate crucial support that you need. So in order to reduce that and not have them go back to a state of being abused or whatever, it needs to be addressed. Oh, he's here.
All right.
Yeah, thank you. I think we have Oladimeji with us, so I'll just go ahead and introduce him. Thank you for joining. We've been mostly talking about, again, mental health care access and advocacy. So we'll just continue the conversation as well now that you've joined us too, but I'll just give a brief introduction of our second panelist. Oladimeji Ogunoye, he's also an interdisciplinary scholar and a program management specialist. In his research, he focuses on the understanding of lived realities as science. His research focuses on the intersection of literature in English and other fields such as health and other sciences. And his master's research examined the depictions of the relationship between mental health, personal discovery in literature. And so he currently leads a national project on improving sexual health outcomes in Nigeria. And he has also been involved in other interventions and projects aimed at improving physical and mental health. And he's also interested in films and poetry as well. So welcome to the session, Oladimeji. And
Welcome, sir.
yeah,
Thank you very
we'll
much.
continue the conversation. I think Ajoke can go ahead and we'll just continue, the conversation from here.
Oh, okay. I would just like to ask a question we asked Rachel, our first panelist. How can governments in Africa close the gap in achieving equity when it comes to mental health care and services in the African region?
Well, all right. Thank you very much, everyone. Sincere apologies, I joined late. I'm in the work retreat. So, if government would close the gap, there needs to be more efforts in advocacy. And then, of course, healthcare facilities has to be equipped, and then there needs to be more emphasis on the importance of public mental health in all public sectors. So beyond people just coming out to say, this is the challenge I'm having, or I think I need to speak to a therapist, I think issues around mental health should be planned into workspaces, especially government offices, in all these parastatals. And then I think one of the things that gets the ears of people a lot now is entertainment. And I think there needs to be more effort in that space, to talk about mental health. So let me stop there. So.
All right.
Yeah, thank you very much. I guess I'll start my next question with Rachel, and then our second panelist will follow. But we've talked a lot about the issues and the barriers, but what are some of the consequences that the individuals you work with or even the communities face as a result of the lack of mental health access?
Oh man, I think of the victims that I know end up being in more isolation and feel more stigmatized for what they've gone through, more shame, because they couldn't find a safe space to go to. And so the community I'm sure they were in also was not providing that safe space, or the family maybe perhaps. And so the one place they wanted to go to denied them that same attention. And so I think that usually will draw them back into a state of isolation and feeling like they are required to do this work alone. And so that's something that we definitely are always trying to bridge that gap and find them and give that immediate support, because I think it's really crucial for someone's healing. Yeah.
All right. Mr. Oladimeji, what strategies can improve mental health awareness and education in the African region? I know you talked about including entertainment, like I'm sure you're thinking of in the line of putting it in movies, but what other strategies can improve mental health awareness and education in Africa?
All right. So I think everything starts from policies. So if mental health becomes something that is central to government policies, especially health policies, even like I said, in work policies, policies that has to do with employment. The issue should not just be about people getting a letter from a hospital to attest to the fact that they are mentally sound, or getting a reference letter from someone. There should be a check, and the check is not supposed to be vindictive. It's something that should help every workspace know how to manage people work, under them. So because many times when we talk about mental health, sometimes we leave these older people who are, who are living in a world that they are not familiar with, not so familiar with anymore, considering the changes that has gone on in the world now. And then, so planning mental health mental health policy statements, and including them in how work ethics, work systems are developed is one thing. Yeah, I mentioned entertainment the other time, but I wasn't limiting it to films. I'm also limiting it to okay, so in the UK, I think during COVID or before COVID now, there was art and medicine, project that was sanctioned, and then we had somebody go to all the hospitals and do drawings, on the wall that can help lift the minds of patients. These are also things that can be copied. Interestingly, the fellow is a Nigerian, so
Wow.
so
Yeah.
we can also plan something like this in health centers. People who are who are in the hospital are not happy. I've had to take care of people in the hospital before, and I know many times you have to do a lot of work also trying to psych them up to believe that things are changing even when it doesn't look like that. But then if they have something they see that tells them, or that kind of make them feel as if, okay, things may not be so fine now, but there is hope. I think that is something that helps. Again, outreaches. We can't talk about outreaches enough. We've seen how outreaches helped during COVID. We saw how outreaches helped, about in issues related to cholera and all these other diseases that we are combating, public health issues. So I think outreaches about public health too can be given priority. And I think if those outreaches are carried out, we are able to reach people in hinterlands, people who may not be able to see your movie, or you probably will just hear that there's somebody who sings, but they are not able to see the person. But if there is a way, people, if these outreaches also focus on how to engage with people of different ages, how to understand the different changes that they go through, there's that. And then planning age-specific curriculum for all these interventions are also things that will really help. For instance, the way you're going to speak to someone who is old will be different from how you speak to someone who is young rather, and then will be also be different from how you speak with someone who is a toddler, or a teenager, for instance. So yeah, so I think let me stop there for now.
All right. Okay, like we discussed with our first panelist, Ms. Rachel Hashweh, like mental health is definitely under-prioritized in Africa. What word can you say to the African government? Like just a statement you can, like an advice. Why is it under-prioritized, and what important thing do you want them to know about mental health? Why should they prioritize it?
Okay, why is it not prioritized? Well, I think in Africa we pride ourselves in being strong. So environmental factors, socioeconomic issues all contribute to how we treat ourselves and even our environment. And many times, for instance, people who live where there is epileptic electricity supply would not have issues if they are somewhere and suddenly power, there's power outage. But someone who has never experienced that before, there's this very funny story a friend told me of a cousin came to Nigeria for the first time, and when they took light, the dude thought he was blind. So so the thought he just turned blind, and also Yeah, so these environmental issues and the I'm careful to use the word underdevelopment, but yeah, these things are one of the reasons why public health does not appear to be a priority to us. There are many other things. You want to eat, you want to procreate, you want to get job, and so whatever you go through in the process, you are encouraged to just keep pushing. And then a very popular saying, when there is life, there is hope. So you keep pushing, and all. And then we have all these stories, that we were told when we were young, and then we still tell younger people too about how trying and trying helps you get your dream. So regardless of what happens in between. So yeah, so that's one of the reasons. But then what can I say to them? Well, we are all seeing the impact this is having on everyone. We cannot deny that there's mental health issues, in the world now. We cannot deny that many Africans are not traumatized from the way they were raised. We cannot deny, that these I'm careful to use the word, but I'll say it, Gen Zs are not ready to also, can I say, tolerate many things that the previous generations could. We cannot deny these realities, and we see many of them commit suicide. We even see people who are old also commit suicide. We see people treat their families anyhow. We see people just ghosting on their families simply because the weight is heavy. And this is a reality now. So the times have changed from when things we could manage things and then just handle things as they come. We are now in times when we need to really, really prioritize what matters. And one of them is public health. Sorry, is mental health. So, yeah. So mental health is really important. So if we don't want to lose the young generation, and if we want to really preserve the older ones, then we need to prioritize mental health.
Yeah, I guess one of the things we discussed earlier with Rachel was also the issue of stigma. So how do we really also combat the stigma as well that exists within our communities to talk about mental health and address the issue of mental health?
All right, so for stigma, well, okay, one of the things I think we need to also do is to speak the truth to each other. We are not entirely different from each other. If someone breaks my heart today, I would cry. They've broken my heart before and I cried. So if they broke your heart, you'd likely cry. So we are not entirely different from each other. We all feel hurt, we all feel pain. So I think any advocacy program, any intervention program should also let people see how alike we are, how much we are not so different from each other. So when campaigns on HIV and AIDS were ongoing, one of the things that was talked about was also stigmatization, not stigmatizing people who have the disease and all. And somehow there is a change. We can see people are trying, to live with this, because I can't pretend that there is no stigma anywhere, but at least it's far better. So I think through publicities, and all, we can also handle stigma as far as public health is concerned, mental health is concerned.
Mental health. Yeah. All right.
Sorry, I keep going. Yeah.
Okay, for Rachel, Miss Rachel, what are some of the challenges you have faced in addressing the issue of mental health and the inadequate mental health care in the African region? How have you overcome these challenges, and what are some of your achievements?
I definitely would go back to just this, the systems and people sort of contributing to this culture of silence and lack of accountability when it comes to, violence or mental health. And like my fellow panelists just shared, it's being able to speak the truth. And I think our workshops do that. We hold space for people's stories, no matter how awful they are, or hard to hear they are, we hold space for them. And our workshops are geared to changing this culture, to disrupting these social norms, and to making sure that we speak the truth, because time doesn't heal all wounds like we want to say. I think action does. I think speaking up does. And so that's a really big way that we try to respond to, the lack of attention of mental health, and also being able to be a resource. Like we've all mentioned, there's just this general gap of just financial resources not being given to programs that work towards mental health, or trauma. And a lot of people in this space who do this work burn out. And so that means there's a high staff turnover, and that requires regular retraining of people, support, additional support coming from community volunteers like yourselves who are doing this work. This is the way that you're helping this space, but you're probably doing it for little to no money because you just genuinely care about it. So something we want to do, like my panelist said, it's being able to make sure that we prioritize money going towards these trainings that we want to hold, because we genuinely care about the mental health of our community members. And it starts so young now. Like you said, the Gen Zs are not responding the way that the older generation did. We're seeing higher rates of suicide, just people disassociating, not being able, there's delay in cognitive development for young children when they don't get the attention that they need. And we want to respond to that, so we don't see higher rates of suicide going on, so these are areas I think we definitely try to stay active in, definitely breaking that silence, speaking the truth, holding these trainings, and then at the same time making sure that policies are put in place, that money is coming through to support smaller grassroots organizations that are doing the heavy lifting. Yeah.
Thank you. Yeah, I'll ask the same question to Oladimeji as well. What are some of the challenges you have faced while doing this work of advocating for mental health and addressing the issue of inadequate mental health care? And how have you personally overcome these challenges? And what are some of the achievements you would like to share as well?
Okay, that's a lot. All right. Yeah, I wouldn't want to repeat the issue of money because I think it's central to all funds. One other thing I want to say is also getting the buy-in of locals. Many times, when you tell people you want to talk about mental health, in many spaces, even in academic spaces, people imagine you're saying they are mad. So, or that they are weak mentally, that kind of thing. So getting people's buy-in, and then getting many, when you do community entry programs, getting key people to buy into the idea. For instance, if you tell people, okay, so we've done advocacy before on WASH, maintaining a clean environment, and the people were so receptive, but when it came to mental health, they were wondering, well, we can't see this one. What are you saying? It's not anywhere, that kind of thing. So I think that's one of the challenges we've faced. And then you said the challenges, right? And what am I supposed to talk about?
Yeah, the challenges, how you've addressed those challenges, and
okay.
any successes
Yes.
as well.
Yeah, well, one of the ways we've addressed those challenges was also to put up community plays. One of the hacks that have worked for us in this time is actually entertainment. Just thinking of something play-based and then presenting it to communities, presenting it to audience, and they kind of find out the problem with you as they watch the play, and then you start conversations. And so many times it worked. It helped people bring up the conversation. But I think the major problem is this cultural issue where it looks as if you're making people Western, in quotes. When you start saying, oh, speak to young people with respect, speak with, there's a way you can convince people to do what you want them to do without forcing them, you know, and also these are the challenges we face. But what we've done so far has been that we never stopped talking. We never stopped putting out whatever it is we're doing. And then we also, of course, as you, like in your case, many times you're doing something new, you put in so much of your resources. So we don't spare resources when it comes to what we believe in. And I really, really, you know, applaud Engage Africa Foundation. You guys are really doing well, you know.
Thank you.
It's mostly voluntary. So yeah, that's all we've done. Thank
Okay,
you.
how do you do self-care? Like in the midst of all this work you're doing, how do you do self-care?
Well, well, I look for what I enjoy a lot and I stick to it. So when I'm stressed, yeah, there was a time that when I'm stressed, I'm able to withdraw myself and just go away and relax and come back. But now I've found, I've tried to find things that relax me. So I just, when I'm stressed, I just engage in them. And then in recent times also, I've tried not to let things get to me too much so that I don't break down, you know, in the middle of work. Yeah, there are times you are talking to people and you are crying, you know, that kind of thing, you're weeping. So I've tried to balance all these things. And then I've also, you know, I've also learned to be humble, to know that even though, yeah, I'm in a team doing this doesn't mean I am immune from it, you know, and then doesn't also mean I will be able to solve all problems. So I try to do what I can. I try to teach the next person how they too can help the next person. And then I let the thing roll on by itself. So yeah.
All
That's
right,
how I do.
Rachel, how do you do self-care?
Yeah, for us, so because we are in trauma healing work, we do try to incorporate sort of these somatic exercises and breathing and grounding exercises. That's really been helpful because again, you know, the Western people think this is just Western stuff. What do you mean you're just sitting there and breathing for 5 minutes? You know, it sounds silly to most Africans, but really it's so helpful for people who are really dealing with triggers and like actual like deep trauma, because it's a signal to your brain that you're actually okay, that you're safe, if you can be able to actually do the breathing and grounding work that, you know, we provide, or the mental health space provides. So that's something that's really, really helpful. And you can do it without anyone knowing. You can do it in a room. You can do some kind of breathing practice without anyone knowing in the room, wherever you are, because you never know when a trigger is going to sort of rise up in a space for you. And I think also something that's helpful, yeah, retrieving if you need some space to just kind of figure out your own internal resources of like what brings you joy, what settles you, what gives you peace, and tapping into that. Is it journaling? Is it creating something? Is it music? But something that works for me is knowing my person, and we try to do this with our advocates as well, is figuring out who are the people in your life that leave you energized, that leave you feeling safe, that leave you feeling like you're going to be okay. So having your person or persons is really important. So you know that you're not, we're in community. And sadly, this idea that we grew up on, I'm sure, of it takes a village to raise a child just kind of seems to be falling at the wayside. It's kind of, you know, disappearing with our generation. And so finding your persons now is getting a little harder because everyone is busy, they're living their own lives, they're working, they're in traffic. But I think going back to that practice of figuring out who in your community is actually someone that is safe for you will come in handy, especially when you're having one of those really rough days and you can't make it to a therapist appointment, you know.
Yeah. Well, thank you both for sharing that. I think we're reaching the end of this conversation, and we've covered a lot of ground: policy, culture, community, stigma. But before we conclude, is there anything you would want to add to this conversation maybe some advice to young people who will be engaged in the festival, listening to this conversation about mental health. I'll start with you, Oladimeji, then we'll go to Rachel.
Okay, so if I would say anything, I'd say when you can, make sure the next person doesn't feel bad as a result of you, of what you have done. You know, it's important we leave the next person better than when we met them. This is not to mean you should put a pressure on yourself to try to make the world, change the world. You know, you're not Superman. He couldn't even change everybody in the films, you know, you've seen him in. So just leave the next person better, then be true to yourself. Don't hide things. Don't have severe complex. Don't think you have, you know, you got it all, you're immune. And then in times when you open to making mistakes and understand that mistakes don't end the world. That's not the end. So that's for young people. And then for those who could be in power or close to power or who are creatives. So when you design anything you want to put out, think mental health as part of it. So there was a time we all started thinking green. And then we started adding green, you know, touch of green just to talk about environmental, you know, preservation in all that we do. So think mental health, think of mental health in what you're doing. You are starting a business in anything you're doing, just think of mental health, think of the next person. And then if you have the ears of government and then you are able to, you're able to speak to them, also talk about mental health. Now, mental health is not a young people thing, it's a human thing. So it doesn't matter the age, it doesn't matter how much money they have. Money doesn't cure mental health. Many times it seems to aggravate it. So think mental health. Thank you.
All right.
Thank you.
That's tough to follow. Yeah, I agree with everything he said. I would go back to that same sentence I said earlier, that time doesn't heal all wounds, and that it's a matter of paying attention to what you're going through and then taking action. And that will look differently for everyone. It's not that everyone will be able to get access to a therapist, but whatever you can do that works for you, take that step. I'll also add to young people that, you know, we work with a lot of university students in Uganda who are graduates, you know, like I said, of social work or criminal justice or just in the mental health space. And one thing we want to encourage them is to know that you don't have to go abroad. You don't have to go to the US or the UK to be scholars, to be experts, to know what your people need. As Africans, like, we know what we need. We have healing modalities that work for us that the West will never understand and will never be able to incorporate in their work, in their spaces. And so I think it's so important that they pay attention to what works, what has worked for our people, what is working, and how do we incorporate that when we go into the spaces of becoming professionals who are in this work of mental space. So we encourage them to look within the continent. And that's why when we do our trauma workshops with them, it's just an addition to what they've already studied. But this piece is encourage them now, look at your surroundings, think about, you know, the history of your country. How did they do it before? Incorporate both. You don't have to go to the US or the UK to come back and do this work. So that's a huge encouragement I would tell to our young people, for sure.
Wow, thank you so much, Rachel and Oladimeji. We are so grateful. And I believe this conversation we've had today would drive improvements in how we treat people with mental disability or illness and how we address mental health care and services in Africa. I hope this will get to the policymakers, get to the citizens of Africans, get to young people, get to older people, and really make a change. Thank you so much.
Thank you, guys.
Thank you so much. We're really hoping that this session will be informative. Again, as you know, Engage Africa Foundation, we're trying to reach many people and really have these tough conversations as young people. And so we can really work alongside each other to continue advocating for comprehensive mental health care in Africa. And as Ajoke already said, we're really grateful. Thank you for your contributions. And thank you for your time, and we're very honored to have you at this year's festival. Thank you.
All right.